Hello everyone, I'm back with another presentation on diagnosis of an orthodontic case. In a previous presentation, it was about how to classify a malocclusion and how is it helpful in diagnosing a case. In this presentation, we'll take it a little further and I'll be talking about a simple clinical procedure called visualized treatment objective. This clinical procedure helps us in finding out the cause of a skeletal class 2 malocclusion and where the fault lies, that is either in the maxilla or in the mandible. As we saw in the previous presentation that the skeletal class 2 malocclusion can be due to either of these reasons, that is an increased maxilla or a forwardly placed maxilla, or due to a deficient or a backwardly placed mandible, or a combination of both. So this clinical visualized treatment objective is a simple clinical tool to differentiate between a skeletal class 2 due to an increased maxilla or advanced maxilla and a deficient or a backwardly positioned mandible. And how do I do it? I'll be demonstrating this procedure clinical VTO with the help of two photographs. As we see, the first picture is the pre-operative or pre-treatment photograph, profile photograph of a patient with a class 2 malocclusion, which is quite evident with her highly convex profile. Now, for doing a clinical VTO, we ask the patient to bring the mandible forward to an edge-to-edge bite, that is, till the mandibular incisal edges touch the maxillary incisal edges, and then check out for the profile of the patient. Does the patient look better or worse? If the patient looks better, that means the VTO is positive. Well, if you see the second photograph, it's not the post-operative photograph. It is the photograph of the same patient after doing the VTO. We asked her to get her mandible forward to an edge-to-edge bite and then checked for her profile. Yes, it has become a lot straighter and she definitely looks better. That means her VTO is positive. And what does a positive VTO indicate? It indicates that the fault lies in the mandible is short, and a treatment modality should aim at treating the mandible. And what if the VTO becomes negative? If the VTO is negative, that is, if the profile of the patient worsens when we advance the mandible and bring it to an edge-to-edge bite, it means that the fault lies in the maxilla. It means that the mandible is normal and the maxilla is excess, and because of which the patient has a class 2 malocclusion. So to summarize this procedure, in a clinical VTO or a visualized treatment objective, we advance the mandible to an edge-to-edge bite and then check for the profile of the patient. Has the profile improved? Does the patient look better? If the patient looks better, if the answer is yes, then the class 2 malocclusion is due to a deficient mandible. And the treatment for such cases would be treating with mandible advancement appliances. That is, functional appliances which help in bringing the mandible forward, thereby stimulating the growth of mandible. And if the profile of the patient worsens with the VTO or with the advancement of mandible, then it means that the class 2 malocclusion is due to maxillary excess, and we treat it accordingly with orthopedic appliances which control the growth of maxilla. For example, appliances like headgear. So this was all about the clinical procedure called VTO, which is quite simple and very helpful indeed. See you soon with more videos on orthodontics. Bye-bye.